session. I'd like to welcome you this morning. Good morning. This is CSSC Forum, and our session will be holding the theme of leveraging private sector to advance health in Tanzania. And in relation of this session, and he will invite the other presenters. So a hand of applause as Dr. David Isaiah is coming.
Good morning once again. Happy to see you in the Spice Island, Zanzibar. I've been given an assignment to just moderate this session, and without further ado, I'd like to invite the panelists. And because of time, let me invite our first panelist, Godfrey Nyombi. Godfrey Nyombi, Health System Strengthening Team Lead at the DATA Tanzania, providing technical leadership for sectoral health system programming with over 14 years of experience. He oversees various units focusing on resilient health systems. He holds a bachelor's degree in health systems and a master's in medical science. Please, Dr. Godfrey Nyombi. Come to the front, please, this side. And I would also like to welcome our next panelist, Dr. Godfrey Kwai. He's a public health specialist with over 10 years of experience in health system strengthening. He's the chief of party for USAID-funded project PATA, pamoja tuwekeze afya, and he supports faith-based health facilities. He collaborates with NGOs and focuses on quality improvement. Okay, I'm back. So, a round of applause for Dr. Godfrey Kwai, please. On stage. Our next panelist is Dr. Ringo Ernest. Ringo Ernest has also over 1,400 years of experience. As you can see, most of our speakers have an immense experience in health systems, and he has been at AR Healthcare managing a network of clinics. And he has worked with CSSC for some time, as now he's working with AHA, African Healthcare Network. Please, a hand of applause for Dr. Ringo Ernest. Our last but not least is James Manyema. As you can see, we have a combination of people of different professions. And he's a senior manager at Mkombozi Commercial Bank, bringing 14 experience in expertise in banking and finance, with a vast background in financial strategy and management. Please, Mr. James Manyema, welcome to the front. Hands for him, please. We are not going to bother you much with a lot of information or a lot of PowerPoints. We want this session to be as interactive as possible. We want to have some moments to ask questions to participants. But before that, I would just like to give a brief introduction of CSSC. As you can see at the background, CSSC is a ecumenical body comprises of church education and health facilities from faith-based background. These are from Catholics and non-Catholics, all Christians, hospitals, health centers, dispensaries, and also education facilities such as universities, secondary schools, primary schools, and even institutions of early childhood education. CSSC has been in the country for more than 30 years. I established in 1992 and I was registered officially in 1983. But faith-based health facilities have been in the country even before independence. We have some facilities which have been established even in 1980s, and they're still existing out today. And as we know the history of faith-based facilities, these were established as charitable organizations receiving charities from abroad and some well-wishers. And for many years they've been run through a combined assistance and some little cost sharing from members of the communities that they're working. But as time goes, operating cost of these facilities have been mounting up, and we have experienced decreased assistance from outside the country, decreased assistance from other NGOs that were supporting these health facilities. But also, we were receiving, and we are still receiving support from government through basket fund, through staff who are seconded, and some staff who are granted in faith-based facilities. But for a long time, there have been like a decrease, not just a decrease, but also number of clients served by these facilities have been increasing, but there has not been a matching in funding with the same level of facilities that they are operating. So CSSC has been struggling to make sure that these facilities, they just not survive, but also they thrive and continue to offer quality services that have been offering in the past, and also cope with the changing technologies, changing world now, coping with what is happening in the world. So the team here is going to explain to us, they're going to, through questions that are set for them, they're going to tell us so far CSSC, how CSSC has been doing, and also through public, we know the theme of this year's conference, public-private partnerships, but we have been also able to establish private partnerships, of which is what we are going to major most in our discussion. So I would like to welcome you to be part of this forum, or as your eyes and ears and your heart also to be part of this forum. And if you are going to give some time at the end of the session for questions, and you can also advise how to do better in the future. So without further ado, let me start. We're going to have 2 rounds of questions, and if time allows, we're going to have another round, but also we'll hear from the mass. So let me start with Dr. Godfrey. You've been with CSSC for a long time now, and you know that the FBO health facilities have been dependent on external funding. Can you tell us, has the transformation been, how has the transformation been towards reducing this dependency? You got my question. Karibu.
Thank you. Good morning. Yes, so as you have correctly said, we've been providing services for a long time, since before independence. So our facilities have been, there are times where we have been 100% funded by the donors, and then in the beginning of 2000, around 2005, because of the PPP policy, our facilities started receiving some funds from the government, and some were being funded up to 90%, I would say. But then that that changed around 2015. There was a major decline of the funding that was coming from the government. Therefore, we had to think of other sources, and basically we started looking at the opportunities that are there so that we can at least improve financing, but also, as Dr. David said, maintain the quality of care. Because financing really affects the quality of service that is being provided. So the journey has been difficult, I would say. We are not there yet, but it was worth taking. So first we had to start with a changing mindset. Like people have to know now we are not in the backyards where you will not think about where you will get the salary to pay your staff, money to buy medicines and things like that. So the mindset change from the owners, the managers, and even the communities to understand now they have to contribute, because initially they will treat faith-based facilities as charity centers where you get like free service. And on the side of the community, we're still working on that, but yes, some people really understand. And recently, with the support of development partners like USA and other partners, we started